Now request the next speaker, Dr. Prithvi Chandrakanth, to give his presentation on IOLSCOPE.
Good evening, everybody. I would like to thank AIOC to give me an opportunity to present this my innovation in this forum. I'll be sharing my video. I hope it's seen.
Yes, it is.
The IOLSCOPE. No conflicts of interest, no financial interest. Microscope has been a boon in the field of science, which has made us realize that there is a world that is too small to be seen by the naked eye. It is the visual bridge connecting the macro universe to the micro universe of a living organism. It has become a useful tool in the field of ophthalmology, which helps us in research, diagnosis and treatment. Use of these microscopes in ophthalmology is largely restricted to laboratories, which is costly, time-consuming and labor-intensive. There is growing interest to develop tools for health monitoring which can be used in clinical settings and field cam setups. Point-of-care diagnostics are being developed to offer advantage over the conventional laboratory-based evaluation method, providing portability, automation, faster processing time, reduced sample volume and lower cost. The goal of point-of-care diagnostic is to make testing widely accessible, such as in clinics, outpatient departments, camp, ICUs and PHCs, etc. Smartphones are being used to acquire anterior and posterior segment photographs with impressive details, which established it as a good tool for point-of-care diagnostics. Its use in fields such as microbiology, pathology, parasitology hasn't been much explored. Here we describe an innovative device which can be easily made and acts as a microscope for point-of-care diagnostics using just a smartphone and IOLs, called the IOLSCOPE. It is required chart paper 4x2 cm, intraocular lens 30 diopters for 4 numbers, micropore, paper puncher and liquid adhesives. How to prepare? Take a chart paper of 4x2 cm, cut it out using a puncher. Make a circular punch on the paper. Take the IOL and place it at the hole created. Using a liquid adhesive, glue it to the chart paper. Let it dry. Once it dried up, you can take the second piece of IOL, keep it on the first IOL, put the liquid adhesive. Do the same procedure for the next 2 IOLs. IOLSCOPE is ready. Now with the help of a micropore, we can attach the IOLSCOPE onto the camera of a smartphone. How to use? With the help of torch for illumination of the sample slide, the IOLSCOPE is used to acquire microscopic images of the sample. The image and video is then recorded and can also be relayed for expert opinion. Here are a few videos of rhizopus, fungal hyphae, caterpillar hair, rhinosporidiosis and inflammatory cells. We conducted a comparative study in which corneal scrapings of 194 corneal ulcer cases were analyzed using both IOLSCOPE and compound microscope. The IOLSCOPE had a sensitivity of 96% in analysis of KOH mount and 100% in the culture mount for fungal hyphae detection. We also conducted a similar study to identify parasites like Demodex and sheep botfly larvae. We also published an article in the Indian Journal of Ophthalmology in which the IOLSCOPE was used intraoperatively in a case of rhino-orbital cerebral mucormycosis to detect mucor hyphae during a FES procedure to determine clear edge for surgical debridement. These are the comparative images. Have you ever imagined that an IOL, which is used for cataract surgery to help patients see the macro universe, with a small tweak used by anyone to see the micro universe? Thank you.
Wonderful.
Fantastic.
Thank you.
Thank you, Prithvi. I think microbiologists should now take a cue from this, and they can do their entire microbiology with this. And I don't know what will happen to the lab microscope companies who actually, do this after adding a camera to it.
Yes,
Only very innovative, Prithvi.
Yeah.
Very innovative. I think must congratulate you. Out of the box.
On a serious note, Prithvi, can you quickly explain the physics behind the imaging?
Yes, sir. This is actually basically you can see here. This is actually a one lens which we use. We have combined 4 IOLs and Aurolab. With the help of Aurolab, we have made one lens which can give almost up to 500 diopter power. And the basic principle is making your camera into a macro lens. Making use of a smartphone camera, transforming it into a macro lens. So the smartphone is not actually having macro lens. The newer iPhone 13 has macro lens, but it's not that great as much as we require. The magnification not as much as which we can do with this one. So basic principle is making the camera into a macro camera so that we can take images. That is a basic principle.
Like a magnifying lens it's become.
Yes.
The adapter of these lenses that you have, is it a particular adapter that you have fixed?
Yes, actually, the thing is, all this goes back because I am very interested in photography. So I've been doing photography over a long time, and I know the optics because I use macro lenses to take photos of minute housefly and all those kind of things. So what has happened is I've used 30 diopter lens IOL of rigid PMMA, and that is what I have been doing. And the same thing we have done the same thing with this one also. The PMMA rigid IOL has been used. 4 30 diopter lenses was used, and this was actually a 100 diopter IOL, which is in air it comes up to 500 diopters. So yeah.
That is,
Thank you so much, Prithvi.
secret by that.
Yeah. So we